Welcome, Dr. Tom.
Thank you, Michelle. It's great to be back. Hello,
Hello.
Karina.
Hi.
Hi.
Thank you for having me back.
Of course.
Having you back. This is the Karina Show. So, Karina, we're going to let you take over today. Tell me, so the listeners who maybe have never listened, this is Karina Lozano, and what is your role at our office?
Yeah, my role, well, I have a few, but my new role is being a surgical liaison or surgical coordinator for the patients.
Perfect.
Yeah.
Okay, so you're the surgical liaison, and today we're going to kind of talk about new trends in cosmetic surgery. You're taking the phone calls and talking to young ladies and older ladies and everyone in between, all right? You know, what are you finding? What are the kind of the questions that people are asking in terms of trends and so forth?
Well, I don't necessarily, people don't, there's not a conversation about what is trending. It's usually what their needs are wanting, but as far as what we're seeing, there is a collective kind of newer way that we are moving with the patients, and that I don't know if they're aware that it's a trend, but they're
kind of falling into a trend that we're seeing.
Yes,
okay.
yeah.
Well, it's interesting that one of the trends that I'm seeing, and we're going to talk today, I should say, about primary breast augmentation. That's with implants usually, and then we're going to talk about removals, lifts, just a lift, and so forth. So we're going to try to cover all of that in the next 28 minutes or so that we have left.
I think we can do it.
Right. So one of the things that I've noticed, Karina, in the last year or two is that we're kind of moving away in the patients who want a primary breast augmentation from thinking big to kind of being a more modest enhancement. And it's sort of been a subtle change that I've seen over the last couple of years. What are kind of some of the concerns that people have when they're calling? And when I say that, yes, believe it or not, we're doing breast augmentation primary on baby boomers, okay? But a lot of them are going to be Gen Zers and millennials, okay? Maybe haven't had kids, or maybe they've had kids. Kind of what are kind of their main objectives with getting an augmentation?
Primarily, most of the time they just want to feel more feminine.
Okay.
Maybe they like the way that they look with the padded bra. They like that look.
Right.
So they're kind of like, I wish I had this without the padded bra. Or, where sometimes it's, I want to wear a backless dress and not have to wear a bra.
Got it.
To give you that, that rounder look of a breast.
I think two key things that you mentioned is that was one, they want to be more feminine, okay? And I'm going to put that out there when it comes to cosmetic breast surgery, is that's probably, if I could sort of generalize the indications or what the want is of the patient, it's going to be they want to feel more feminine, okay? And everybody has their own specific idea of what that means, right? And then the other you mentioned, which made me kind of smile, was you said that they want the look that they look like when they have a padded bra on. And I have to tell you that when I first started, let me backtrack. So I previously was a general vascular transplant surgeon, and about a third of my practice revolved around breast cancer and its diagnosis and treatment, okay? Brought to Dr. Tom Cosmetic Surgery because of the fact that we do everything under local, and there was this big demand for that. Brought primary breast augmentation to the office, and it's become our number one operation, okay? But I do remember some 10, 12, whatever number of years ago that we started, oh my God, it's longer than that. But when we started to do that, I'd walk out and introduce myself to the young lady, the patient, and bring them in. And so many times I looked at them and I'd say, why are they here? Okay, fully clothed, it didn't to me seem like they needed anything.
Right.
It was the padded bras.
Yes.
Yeah,
they make a big difference.
They make a big difference, okay? And being a guy, I didn't have any idea. I didn't know that. And so I think that's a great way of kind of categorizing what women want. They can do all sorts of things, put on makeup a certain way to get a certain look, wear certain clothes that enhances, even if we think we're not into cosmetics, your shoes, the color of your hair, all of that is part of how we project ourselves out socially, right? And so women want a certain look, and a lot of times it's with the padded bra. What I've noticed, Karina, is that patients initially were, when I first started, was that they wanted to go fairly big. And a lot of times as their physician and advocating for them, although I want to do what they want to try to achieve their cosmetic end result, we would do measurements, we try to figure out what's going to be the best and safest route for them to go. And you and I know we spend a lot of time with them. So the hardest thing I think for a patient is trying to figure out, even though I see a trend of smaller, I'm going to say a more natural enhancement look, that one of our staff members, or one of our nurses, when said to me that we had performed an augmentation on, she said to me, Karina, I don't know, speaking to me, how I do that. How do you do this? How do you guide the women? Because even they don't know what they want, right? And, in terms of what size. And so what do you usually recommend for these patients as they know they want an enhancement, but they aren't sure what to do or what size they want to be?
It's definitely, if it's the first time they've never had anything, they don't have implants, the rice bag test is the easiest way to kind of come into us and say, this is what I did with the rice bag test.
Correct. Okay, so what is the rice bag test? Because somebody's driving along on 101 right now listening to us, and they're saying, rice bag test.
It's actually been around for a long time, and we're not the only office that uses it. So it's a fun little test. You go to the grocery store, pick up some of the little bags that you get your vegetables in
the produce department.
Department.
So you lift a couple of those bags.
Just borrow a few. You're keeping them, so they're not borrowed.
Okay,
take a few. And then you go home and just any rice that you have at home, not cooked rice. And you put it in your little baggie and you make a fake implant with it. And then you just kind of put it in your sports bra and walk around, try out, a cup or a half a cup or 2 cups and 3 cups, see what that feels like. And then we can do the conversions for the patient later.
And for those who want to know what conversion is, and you can Google it, but it is basically there are 8 ounces in a cup, and an ounce is 30 ml or milliliters of 30 cc's, 30 cc's. So, and a cup of rice is 240 cc's. 2 cups of rice is 480 cc's. So that kind of gives you an idea. And women will try this on. We tell them to wear a tight shirt, and so they can really get a sense of it, and kind of maybe do that for a day or so, and come back. And it's surprisingly accurate, isn't it?
Yeah, for the most part, I think people get a good kind of idea of what they're wanting to do.
I know that Michelle has a question for us.
I do. So they're trying it out, and you want them to have something tight on so they can see it. Do you also recommend that they try some clothes on that maybe that they like to wear, so they see sort of what those proportions look like in clothes that they like to wear?
Definitely, we absolutely do. And in fact, a lot of times when they're coming in, after we do the rice bag test, and they may say, I want 350 cc implants, we have them in our office. We'll ask them actually to come in and to wear, if they can, a tight black t-shirt if they have, or a workout shirt, and put that on, because it really can show them what it will look like on themselves. And so definitely we want them to do that. You go and maybe run around for the day doing their chores or whatever. Kind of have to figure it out if you have young kids, telling them what mommy's doing, filling up bags with rice. But you can be creative, and that's a great way. And definitely it's something that you should do. One recommendation I would have is don't listen necessarily to what your friends did, because they're a different size. The ultimate size of the breast is equal to what you have as your native tissue, right, Karina? And then the implant, and also the size. If a certain size implant's going to look different on a 6-foot tall woman versus a 5-foot tall woman. So you want to do what's right for you. So I'm definitely noticing with breast augmentation that women are tending to pick a smaller one. What are the things when they talk about breast augmentation, Karina? Tell me when they kind of look at the sphere or the globe of the breast impression, what is one of the things that they're all kind of looking for? Anything? Can you kind of guess what I'm thinking of?
They do like that push-up bra look, that fullness at the upper portion of the breast.
So what Karina's referring to is what we call upper pole fullness. So if you look at the breast and you draw a line across the equator of the breast, there's the southern hemisphere and the northern hemisphere, or with the upper pole. Women like that upper pole look. And so that's where we have time to educate them. There are different types of implants. We're not going to go into that on the air. It would take too much time, but we would talk to them about the different types of implants that are available where we can try to achieve more of that upper pole fullness. And I definitely see that women of all ages tend to want that more. So even though they're going smaller, they want to have more upper pole fullness, and we work very closely with our representatives from the breast implant companies, and they have certain types that will achieve a little bit more upper pole fullness for the patient than maybe the more traditional implants. Okay, so that's one thing. Are you noticing, what are you noticing in terms of women who've had implants for a while and they contact us? What seems to be the number one request for those women?
Yeah, those women have, had their implants a few years now, 10 or more, depending on how long, they've, have to do body changes, kids, breastfeeding, sometimes, if not most of the time, and they're saying, now my breasts are kind of drooping, and maybe they're a little too big, and they're kind of looking to either go smaller or maybe even the same size, but usually smaller.
Smaller, right. And that definitely is another trend that we're seeing. So, life changes, and how my outlook on life was different at 20, 30, 40, and I'll kind of skip those other decades that I belong to. But we know that, and you're a Gen Zer, and the difference from 8 years ago and your kind of thoughts in life and what you wanted are different, I would assume, Karina. So a lot of these patients are actually looking to go smaller, but what they're tired of is maybe the breasts are hanging down over their rib cage, and it gets back to that feminine look that they're looking for. Do ladies talk to you at all about their breasts hanging over the rib cage, hanging down, and what that means for them, or what they don't like about that?
They just one thing that they always say is, I want them back where they used to be. That is, I don't think they're like unless they have really severe drooping, but they always the most common phrase is, I want them back where they used to be.
Right. Okay, so they want them back where they used to be.
Yeah.
We did have, and I love our patients. Some of them are so funny. I had one young lady who said remember, I'm a baby boomer, so everybody who's younger than me is a young lady, so even in the 50s and 60s, okay. But I had one young lady who said that she felt like her nipples were racing down towards her belly button, okay? and really, even though she was making a joke, she felt that way, and it didn't make her feel very feminine. So definitely with an implant, it is weighted, so gravity pulls more, and that can accentuate that descent of the breast down over the rib cage, making a woman not feel very feminine. So they definitely are looking to get a lift, and so we talk to them about that. And definitely a trend, and today we're kind of talking about trends that I'm seeing, is that most of those women want to be smaller. I'm going to say probably 90% of those ladies want to be smaller. In fact, they'll say to us, I wouldn't even mind if you took the implants out. I'm done. I'm done with having larger breasts. I enjoyed them, but now I would like to be smaller. And one key to that, Karina, have you noticed that when we have women lift their breast up or they have smaller breasts, what does that do for their whole body image?
Yeah, it definitely allows us to see their rib cage, makes them, they're like, wow, that's there. My rib cage is there. It makes them look heavier. Not that they're overweight.
Lifting them makes them look heavier, or
no. Lifting the breasts up helps their body look a little bit more slender. Not even if they're not overweight, just that bulkiness there creates that illusion.
Right. I remember I had a woman who's an aging baby boomer like me, and she is tiny, and she said, she's seeing us for some medical cosmetic things, and she said, Dr. Tom, am I crazy? I'm in my 60s, and I'm thinking that I want to have a lift, and so we just sat and talked and tried to feel what was her pain, and she was actually petite, but she was really buxom, and it really bothered her, and it was funny that when we were in the photo room with her, Karina, and I think you might remember that, we just said, kind of lift your breast up, and all of a sudden it was like, wow. It went from a woman whose physique she felt more matronly or less feminine to where she just looked thinner and younger. And it's amazing how elevating the breast up off the rib cage, off the abdomen, can give a more youthful look to patients. And we all wouldn't mind looking a little bit younger, looking a little bit healthier. So removing the implants and doing a lift definitely is a huge trend in our office. We're seeing that quite a bit, right?
Right.
And then there are some women, Karina, who are just large, just naturally, or maybe they're not large in terms of the breast area, I should mention. Their breasts are just hanging down, and so we just do a primary lift for those patients, and they really are some of our happiest patients.
Yes.
Definitely happy. I love doing the technical part, and you're part of the team, right?
Right.
It's definitely a technical exercise for us in terms of getting a really good result for our patients. I'm finding that those subsets of patients are some of the happiest patients that we have.
Yes. Yeah. They're just happy.
They're just happy to have the breasts lifted, and most of them, they're just sort of like happy that they, in fact, they'll say to me, you know, I wish I would have done this sooner.
Yes.
I wish I would have done this sooner. Are there any other trends or questions that you have noticed in women who are calling us about their cosmetic breast concerns at all?
Definitely smaller. There's not much, I don't think there's much of a trend between saline or silicone,
Right.
but I do think that most women do have silicone as opposed to
Silicone, right.
saline.
So we can talk a little bit about that. I know there's going to be a subgroup of people who feel that there is breast implant disease, which I think can happen, and where the body reacts to that, and they may develop some systemic symptoms of tiredness, achiness, and so forth that can occur. I do think that it can. I do feel in our experience that it's a very, 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 very small percentage. The concern, of course, is with silicone, and we're finding that silicone, why do you think women, I'm going to backtrack, why do you think women prefer silicone over saline implants?
I think it has a more natural feel. You know, it feels more natural.
Feels more natural,
especially
so it feels softer.
Especially for the women who are first time and they don't have a lot of their own breast tissue.
Right.
It helps, you know, mimic that real breast.
I would agree. So if you're really small breasted, A cup, smaller, and you want to be a C cup, this just as an example of size enhancement, that if you don't have a lot of tissue, that silicone is definitely going to feel more natural, okay? And so I think that's why most women want that. And it's been shown now, as it's been very much studied, that it's very safe, and that seems to be the implant of choice for most people. The saline can be an excellent implant. It actually is a little bit more balloon-like in terms of how it feels. So some people may feel that that's a negative, but I actually find, especially in the lift patient, Karina, in the lift patient, that we use that balloon-like effect to its benefit. You actually get more of a lift, in my opinion, with saline implants than you do over silicone. So, you know, you have to play the yin and the yang of this and figure out what it is that the patient wants.
Right.
So I have 4 patients who want to lift, and they want to, maybe they have had implants, but they want to go smaller. Going smaller again, that's going to allow more descent of the breast. So a saline implant may give you a little bit more lift and fight against that kind of that undesirable effect. And Michelle, you have another question.
I do have another question.
Great.
So you talked about this rice bag test for women who are looking for larger sizes. But what about those women who are looking for a reduction? How do you help them sort of visualize what a different cup would look like?
Okay, great question. So for those, in case you didn't hear that, on YouTube, because Michelle's not talking directly into our little phone that we're doing YouTube on, and you can check us out tomorrow on YouTube for this show. That's a little bit tougher. So women who are large-breasted and want to be smaller, as we try to guide them in terms of their size. Karina, maybe you can describe, but what is your sense when we're in the photo room and we're evaluating them? What are kind of some of the questions that we ask to try to get an idea?
There's definitely a lot of factors that play into it. So if they have an implant, is finding out what they have now, what is their current sizing, and then just kind of, you know, are they active? Questions that we ask, how active are you, you know, and then what percentage of how much smaller would you ideally want to be? So a few factors that kind of help guide them, and they can help give Dr. Tom some clues as to
Right.
what it is that they want to do.
And I do have Karina is in the room with me. I always have a female staff member chaperone in the room with us. But I will also they're just not a chaperone. I'm using them and their expertise because they see a lot of our patients with me. In fact, they see all of the patients with me, and they're a woman, and so they can kind of give some. I'm going to say advice or some guidance to our patients as they're being evaluated. So I would say that a trend that I'm seeing, Karina, for women who've had breast implants and they want to lift, if they have enough of their own native breast tissue, that means enough breast tissue when the implant's removed, many of them opt not to have an implant and to have just a lift. I think where Michelle was going with one of her questions was, what about someone who's just buxom naturally? Maybe they've had a little weight gain, menopause, whatever, just their genetics, and they want to have smaller breasts. How do we help them? And you alluded to that, Karina. We probably the way that we try to do that is we ask them, what percentage, Michelle, or what fraction smaller do they want to be? So in other words, do you want to be 20% smaller? Do you want to be a quarter smaller, 25%? Do you want to be 30%? Do you want to be 50%? You'd be surprised at the different answers that we get. And then, Karina, you alluded to, you said, what are their goals, how active they are, and so forth. All of that comes into it. And also, part of it is the patient's self-image, okay? So for some women, the breast itself isn't part of their self-image, so they want to go smaller.
Right.
And then we will get some women, and this is, please, listeners, don't be judgmental, that's just who they are. Their buxomness is part of their self-image, okay? And so they want to lift, they want a reduction, but maybe not as much as the other person who the breast is not as much as their self-image. So again, we kind of work with them in terms of reduction and trying to know how much they want to do. And then ultimately, it's a conversation that we have, and then us on the operating room table, talking to the patient and all, getting a sense of how big they are, how much smaller we want to get them, and that's how we help them. So it's a lot of talking, a lot of evaluation, a lot of photos, a lot of looking at the photos with the patient, looking at themselves live to try to determine that. What do you think is sort of the percentage, if you will, or fraction that you think most women who never had an implant, they're just buxom, and they want to go smaller, what do you think that number is? We didn't talk about this beforehand. I'd like to know what your kind of guesstimate is, because I have a guesstimate as to what I think it is as well.
What percentage smaller they want to be?
They want to do.
Yeah,
yes.
So usually I would say about anywhere from 20 to 30% where they're wanting to go smaller. I would say.
I think that's true, and that can make a big difference for patients. Now the women who are really, really big, okay,
Right.
they want to be definitely even a lot smaller
Yeah.
than that. Okay, they're having back pain, shoulder pain due to just the size and enormity of their breast tissue. The what I would say is the first reaction I get from women is, oh, half the size.
Right.
And that's what the first thing they say is, like, I'm done with these girls. Just I want them to be half the size. Then we say, okay, let's evaluate you, looking at photos, looking at themselves, kind of getting a sense, kind of hiding, with their clothing, a certain percentage of the breast tissue, and usually when I do that, they go from about 50%, and I would agree with you. I think it's probably closer to around 25 to 30%, and again, it kind of depends on age of the patient, individual personal life situations, and all that helps us to make those decisions. So in terms of just the trends that we're seeing, again, Karina, I'm seeing that women definitely are wanting breast augmentation, but a more natural look. They do like to keep that upper pole fullness, which isn't necessarily a natural look,
Right.
but it's become the standard of beauty that a lot of ladies like. They're tending to go smaller. What I'm seeing is with lifts, especially if they've had implants, they absolutely 90%, probably 95% want to be smaller. They will either want to go with a smaller implant or not have any implant at all. And for those who are wondering, why do you need a lift when you remove the implant? when you remove the implant, because of that loss of volume, the breasts are going to hang down even further.
Right.
And that's not a goal for most women. That's not a goal for most women. So we will remove the implant, maybe a smaller implant. Sometimes we go to saline because it's a little more balloon-like, gives them a little bit more lift. And then for the women who are just looking for reduction, usually it's a combination of removing some breast tissue or maybe some liposuction, which will help to reduce the volume and doing the lift. And those patients are very, very happy. So some of our happiest patients are the reduction patients. Yeah. So thank you, Karina, for being on the show with us and giving us your insights. It's always great to have that, especially if you have any questions. Please call Karina. She is a wealth of knowledge. And I'm going to turn us back over to Michelle.
All right, one more quick question,
Yes,
Dr.
one
Tom.
more. Okay.
What is the timeline? What should people expect? How far out are you booking right now for breast surgeries?
What do you think that is, Karina? You can answer that better.
We're getting close to the end of the year, believe it or not.
Oh,
so for us right now, November,
Is
September
what we're booking into.
is kind of
Okay.
what
So
we're
definitely, if
booking
you're
into.
interested, give us a call. We can get you in quicker for an evaluation. We want to do what's right for you, but definitely give us a call.
Yeah, and especially those patients who say, I wish I did this sooner, right?
Absolutely.
All right, so be sure to reach out to Dr. Tom and his team. You can find them online at drtomcosmetic.com. He has offices in Santa Rosa, Napa, and Maui. You can also always give a call for a free consultation. That information is free, 707-542-8346, 707-542-8346. We'll see you next time.